Very well. I hope you're all hearing us well and you're all connected, and we can start today's session. Good afternoon to all of you once again, and welcome to this weekly briefing on the COVID-19 pandemic in the Americas. I'm Sebastián Oriel from the Communications Department of PAHO. We're transmitting live through webinar and Facebook and Twitter. We have simultaneous interpretation into English and Spanish. On the bar below, you'll see a button called Interpretation, and there you can choose the language of your choice, as we explained, or you can speak here at the floor. You can also ask questions also in the lower bar where it says Q&A. You can ask your questions on the Q&A bar. We remind you that this session will last around 45 minutes, and we will be hearing the questions up until then. Today, PAHO's director, Dr. Carissa Etienne, will report to you on the current situation of the pandemic in the region, with special emphasis on the impact it's also having on health, social, and economy. With Dr. Etienne, you have Jarvar Barbosa, the assistant director, Ciro Ugarte, the director of the Health Emergencies Department, Dr. Marcos Espinal, director of the Communicable Diseases, and Dr. Silvan Alighieri, are in the Health Emergencies Department and also the Incidents Manager for COVID-19. Now I would like to invite Dr. Etienne to say her opening words. Dr. Etienne?
Thank you, Sebastian. And let me wish each of you a good afternoon. And thank you for joining us. As of yesterday, the region of the Americas has reported 1.74 million cases of COVID-19, and more than 104,000 people have died from the disease. We are deeply concerned with how rapidly the pandemic is expanding. It took our region 3 months to reach 1 million cases, but less than 3 weeks to nearly double that number. During the last week, 266,269 additional cases, including some 20,000 additional deaths, were reported in the region of the Americas, representing an 18% relative increase in cases and a 23% relative increase in deaths compared to the previous week. Between May 4th and May 11th, more than 96,000 additional cases, including 5,552 deaths, were reported in South America. That represents a 45% relative increase in cases and a 51% relative increase in deaths compared to the previous week. In South America, health systems in large urban centers like Lima and Rio de Janeiro are quickly becoming overwhelmed. We are also witnessing a similar impact of COVID-19 on big cities across the Amazon basin. When transmission is high in areas that function as regional hubs, neighboring areas are then quickly affected as people move through roads and rivers, impacting smaller towns and remote communities, including indigenous areas where access to healthcare is challenging. PAHO continues to coordinate the response across countries, but we call on national and local health authorities to work even more closely together to contain the spread of the virus and support health systems' capacity. Several nations, including some in our region, have shown that the caseload can be contained with strong surveillance and detection, coordinated public health and preventive action, contact tracing, and surge of the health system capacity. While we remain in this dangerous stage of the pandemic, financial resources are needed to help people cope with the economic impacts of staying at home or being out of work. And this is vital to keeping the virus in check and reducing the duration of this crisis in each country. And COVID-19 is having economic impacts on our countries. The disruption caused by COVID-19 have shaken our economies to their core. The Economic Commission for Latin America and the Caribbean, ECLAC, estimates that our region faces a contraction of some 5.3% this year in the economy. That is the biggest drop in over 100 years, and it is even worse than the Great Depression. The value of exports is expected to fall by 15%, impacting many countries in Latin America and the Caribbean that rely on exporting commodities. Tourism has been greatly affected, further impacting the economies of the Caribbean countries. The sharp rise in unemployment across the region has already pushed families into poverty, and more will follow. It is forecasted that 29 million more people will find themselves below the poverty line, the majority of which will be women. Heads of state and ministers of health and finance all face the same dilemma: how to keep their people safe while also protecting the livelihoods of families and communities. It is a difficult balance to strike, but I dare say not an impossible one. Strong economic activity requires people to feel safe and confident in the future. Just as poverty and social vulnerability are barriers to accessing services and staying healthy, we cannot isolate or pit one set of solutions against the other, or we will fail on all fronts. This pandemic has forced us to address three emergencies at the same time: health, social, and economic emergencies. And to be successful, we need a joint approach. So, how do we address those three emergencies together? Countries must support their economies while building strong social protection networks and embracing evidence-based public health measures that are essential to saving lives. Only when countries have controlled transmission will they be in a position to implement a well-planned, cautious transition period. During this time, countries should continue to focus on health, strengthening surveillance systems, monitoring health services, and rapidly responding to any resurgence of the virus, while also devising ways to stimulate our region's economy and address poverty. We see a path to recovery in which the health sector is central, both as a guide on how to keep people safe and as a foundation for economic growth and well-being. Countries are realizing that we must work together to strengthen pharmaceutical, vaccine, and medical device supply chains in addition to our food systems. We also need to explore regional investments in manufacturing these fundamental tools and to reduce our dependency on imported products. And it is in this context that ECLAC and PAHO will be working together to shape a new model where resilient health systems and universal health coverage are viewed as key to economic growth and social protection. PAHO is also in close dialogue with the IMF, IDB, the World Bank, and others to help coordinate the economic response in the Americas and to ensure that future investments are based on the best evidence available to guide public health decision making. We are here calling for a new paradigm, one in which the health of the people is at the foundation of a nation's wealth. COVID-19 reminds us that when we invest in health systems, we keep our people safe and our economy strong. When we guarantee access to health services for everyone, we reduce inequality and build more resilient societies. Over.
Thank you, Dr. Etienne. Let us now go to the questions. We have received some via email as well as via the chat. Remember that you can write your questions where it says Q&A in the menu bar. And please identify yourselves with your name and your media. The first question comes from Verne Extrabol from Trinidad and Tobago, CCM 919, who asks,
Has PAHO developed any stigma and discrimination health promotion or strategy to support healthcare workers? Doctora Etienne?
So thank you for asking me this question. Today, May 12th, we observe International Nurses Day. And PAHO wishes to celebrate all nurses today. And we wish to pay special tribute to all nurses who are on the front line of the COVID-19 pandemic, in hospitals, in health centers, in schools, and in the wider community. Since the COVID-19 pandemic began, nurses have been essential in protecting people's health and saving lives. The entire population applauds their courage, their commitment, and their dedication. Regrettably, however, some of our healthcare workers are subjected to stigma and discrimination, but not only in COVID-19, but also in many other outbreaks and conflicts all over the world. Many healthcare workers all over the world have even lost their lives because of this. Stigma and discrimination in all its forms must be abhorred and condemned. And in these times, we stand firmly against stigma and discrimination of our healthcare workers. And let me invite all of us to join in this call for the end of stigma and discrimination for our healthcare workers. So WHO has published a guide to preventing and addressing social stigma and discrimination that is associated with COVID-19. And they have also, with this guide, published communication tips and messages that can be used. Let's hope we can bring stigma and discrimination against healthcare workers to an end. Thanks.
Gracias, doctora Etienne. La siguiente
thank you,
pregunta.
Dr. Etienne. Our next question, well, actually, there's several that refer to the reopening or the relaxing of the measures and surveillance. The first is from Urania Cecilia Molina from Diario La Prensa in Panama, which says Panama is preparing to begin to reopen its economic activities, but still has more than 100 cases a day and about 7 deaths a day. With this situation, what would be the recommendation PAHO would give regarding the reopening? And in the same sense, Barbara Fraser, who writes for The Lance, and Angela Valdivia from the Diario La República in Peru, both asking, Peru is also beginning to reactivate its economy. What surveillance measures should be implemented by the countries to avoid further outbreaks after the opening? And they also ask, what's the main recommendation once the quarantine is lifted in the countries? Dr. Barbosa? Thank you for these questions. This is the concern of many of the countries of Latin America, even of here, the United States as well. The fact is that we have a mosaic of situations on COVID-19 in different parts of the world. So much of the news of one country can be compared with other countries, but the people all think that they're in the same situation, and that's not the case. We have countries like China and many European countries that already had an important outbreak of COVID-19, and they were able to control the transmission, and yet now they're beginning the transmission process. The situation in Latin America in general is that in most countries of the region, in the last 2 weeks, there's been an increase, an important increase in the number of cases, which tells us that the community transmission is still very strong. But in a general way, what are the recommendations for the transition process after a series of social distancing measures? First, that they control the transmission with an active surveillance system in a position to test all suspicious cases, that there are no community transmission cases, that there could be some isolated cases, but that there's no longer strong community transmission as at the beginning. Second, that the rate of occupation of the hospital beds and the ICU beds and the ventilators be well controlled below the actual capacity of these hospitals. And that's when the process should begin in a very cautious way. In the larger countries, I'm sure there are different transmission realities in the different provinces, states, or throughout the country. So it has to be done in a regionalized way, in a very carefully planned way, beginning with what's most essential, and to have at least 2 weeks of separation between one stage and the other, so that if we begin to open some of the more essential activities, and that may lead to an increase in the number of cases, then they can immediately stop the process and maybe go back if necessary. And for all sectors that are going to be opening when the time comes, it's important to keep all the hygiene cares of all the surfaces, maintain a meter and a half distance between people, or hand washing, protection of all the staff. All of these things require a very careful plan and a very cautious plan. We cannot do this during the period of community transmission growth, because if it is done unplanned, it's going to increase the speed, it's going to produce more cases, more serious cases, and the ICU beds and respirators might not be sufficient. Thank you.
Gracias, doctor.
Thank you, doctor.
Siguiente pregunta
Our
llega
next
de
question
Laura
comes from Laura
Sepúlveda de La Voz de
Sepulveda from the Voice of
Laura
America, which says,
considera la OPS
does
que hay
PAHO believe
transparencia
that
en
there's
la entrega de datos
transparency
en
in
América
the
Latina,
delivery of
en
data in
especial
Latin
en
America,
Venezuela y los
especially in
países que han
Venezuela and the
norte?
countries
Y
of
cómo
the Northern
considera
Triangle?
que la carencia
How
de
do
los
you
mismos puede
consider that the
afectar
lack
al
of these
manejo
could
de la
affect
crisis?
the management
Doctor
of the
Espinal.
crisis? Dr. Espinal? Thank you for that question. PAHO, of course, considers that there's transparency. We must recall that PAHO has 35 member states and is following 54 countries, territories, and areas. To generalize is somewhat difficult. There are some countries that have challenges, and we've referred to past briefings to countries where the reporting should improve. The problem of Venezuela is that it uses a large number of rapid tests for the diagnosis, which is not the most reliable because it could have a lot of false positives. But it is important to recall also that many or most of our countries are reporting the cases, as we see in different web pages of PAHO and WHO. So there are always challenges for the countries, and some of them will have to improve. But in general, we could say that countries are all reporting in a very transparent manner, publicly and through the mechanisms of the international health regulation managed by PAHO. But we must recall that it's not enough to do the reporting. If the countries are reporting a given number of cases, but are not doing many tests, then it doesn't actually reflect the true situation of the outbreak in each country. That's why the organization's message is consistent increase in the number of testing so that the people can have access to these tests and the country can have a clear idea of how the outbreak is in their own territories. Thank you very much.
Gracias, doctor. Y justamente con su respuesta también dio
Thank
respuesta
you,
a la misma
doctor.
pregunta sobre los
And
números
your
de los volúmenes
answer
que nos acaba de hacer Cody
also
Webble
was
desde
what Cody Webble
ABC
that
Miami. Gracias.
from ABC Miami
Siguiente pregunta
posited. Next question
viene de Bárbara
has
Pfizer,
to do
también que
from
escribe por The
is from
Lancet, y su
Barbara
pregunta es así.
Pfizer, and the
La
question is
Federación de Nacionales
the
Indígenas
Federation of Indigenous Peoples in the Amazon Basin has reported more than 26 cases of COVID-19 and more than 350 deaths in the indigenous populations. What is the assessment of the PAHO or of the way the countries are dealing with the virus in these among these peoples and how to improve treatment and prevention? Dr. Alivieri. Thank you. It's a very interesting question, positive, but Dr. Fraser, so we share the risk analysis in terms of the situation among indigenous peoples. The countries in the Amazon basin, and there are several, are facing a large um, challenge in this phase of the pandemic because in the Amazon region, there are large cities. And after cases were imported to these large cities, there is a very high risk of multiplication, amplification in these relatively large Amazon cities. Manaus, Leticia, Iquitos are cases in point. And in those cities, there are several risk factors: concentrated poverty, comorbidities, diabetes, cardiovascular disease, and also the human density. Those are the risk factors. Um, and they are amplified in these urban centers. They are disseminated by rivers and roads, reaching indigenous communities that face access challenges to health services. So, what we are recommending in this type of situation are first, since we're talking about border areas, a very quick exchange of information among countries, among the border provinces, so that the neighboring countries can take very fast steps and also ensure an association of the indigenous groups to decision making, including health promotion, ensuring that those rules are translated into their languages, that they're culturally correct, that they include prevention, that talk about contacts, quarantine, and isolation of the patients. Thank you. Thank you, doctor. The next question is Ana Portela from the Bloomberg Financials. The question is, health professionals in Mexico are eh, talking about the very bad quality of the protective gear, like, for example, masks. Materials that come from China are case in point. What does PAHO know about that? Are we doing anything about that? Dr. Ugarte. Thank you for the question. PAHO, from the beginning of the pandemic, has been training health personnel physically and virtually, and has promoted the development of guidelines not only about the use of PPEs, but also technical guidelines about the quality of these PPEs and where is it they can get the best. PAHO has distributed PPE to almost all the countries in the Americas, but small amounts for the first cases. There is a guideline in terms of the quality of this type of protective equipment. And everything that is bought through the PAHO Strategic Fund and whatever is bought with the participation of WHO are in keeping with the safety characteristics. At different levels of health services, there are different levels of PPEs, especially masks. And that is something that we've been monitoring very closely. And let me say that PAHO has worked with the countries to assess the needs, and we're making efforts to ensure that there's adequate number of PPEs for the health workers in the Americas. Thank you.
Gracias, doctor.
Thank you, doctor.
Siguiente pregunta
The
la hace
next question,
Rodrigo Caetano de
Rodrigo
Exam.
Calcano from Exam.
Dice que
The question
the
is,
rapid spread of the disease in Brazil is a risk for other
la dis
countries in the region. Doctor Espinal, ¿puede tomar esta pregunta?
¿Pudieras repetir la pregunta, por favor?
Sí, claro. La pregunta de Rodrigo Caetano de Exam es: The rapid spread of the disease in Brazil is a risk for other countries in the region?
Well, definitely, that's a very good question. Brazil has one of the highest number of cases today, and community transmission is taking place. And let us remember also that our borders in many of our countries are porous, very porous. So it implies that countries need to take action together also and separate. So PAHO is working with Brazil to ensure that the authorities receive the proper technical cooperation and all the advice that is needed. It is important to say that Brazil is a federal country, and like for instance, in the United States and other federal countries, the governors in the states have the power to implement mitigation, containment measures to ensure the epidemic is contained and as much as possible. But certainly, the increasing of cases in Brazil in the last several days, it's a case of concern. And the call is that to continue strengthening the measures and the actions as recommended by WHO and PAHO. Thank you.
Gracias, doctor. La
Thank
siguiente
you, doctor. The next question, Alina Dieste, AGP. According to the PAHO models, when will the community transmission phase end in Latin America and the Caribbean? Dr. Alighieri, maybe you can answer this question. Thank you for the question. At this time, we do not have a model to predict when community transmission will end. Right now, the models that we have allow us to know, as a function of the implementation of public health measures, including travel restrictions, when it is that the restrictions can be lifted as a function of the trends. The model is an important aspect for planning services. It is not something magic that will allow us to give exact dates. We use models to plan services and to give adequate treatment to patients, including in ICUs. Thank you. Thank you, doctor. Melina Ochoa, Uno TV. The question is, the Americas regions has had the capacity to respond to the pandemic. In Mexico, we see different epidemiological curves depending on the area of the country. How to work to ensure there's no new outbreak? Dr. Barbosa. Thank you for the question. The region of the Americas is responding, making all efforts through its ministries of health, using the experience that the region already has. Let's remember that from the beginning, the Pan American Organization of Health has given technical cooperation to the countries. The Americas were the first region to have the capacity to conduct PCR tests to identify the first cases. It is important, however, to mention that no health system in the world has the capacity to respond to this COVID-19 pandemic if social distancing to reduce the speed of transmission are not adopted at the adequate time. This happens in countries that are developed and rich, the north of Italy, New York. The social distancing measures were not adopted, and so the number of serious cases that will need ICU treatment and ventilators were not able to respond. That's why when we identified in the last 2 weeks the growth of cases in Latin America, the Pan American Health Organization, our Director Etienne, has been talking to all ministries of health so that this is the trend we see in the country, a trend of growth. To respond to this trend, we have to reduce the speed of contagion and prepare health services, broaden their capabilities, implement plans for rapid growth of their capacities to save lives. And that is the objective that we have right now. Thank you, doctor. We have uh, questions about Nicaragua. Claudia Torrens and Gabriela Seltzer from AP, Yvette Mundia from Confidencial. The question is more or less the same. There are reports in the sense that the government has said, reported 16 cases, 5 deaths. That's well below reality. The government of Nicaragua is not reporting the cases of people affected by COVID-19. What type of cooperation does PAHO have with the country? And have community transmission been detected in Nicaragua? And where is it localized? Dr. Ugarte. Thank you. It is a very important question, but there are several questions there. Let me say that there are several non-official reports that say that there is a high number of patients that were admitted to hospital with acute respiratory syndromes in Managua, Chinandega, and other places. There was an increase in the number of deaths for, due to pneumonia and other conditions in Nicaragua. Nicaragua is the only country in the Americas where the type of transmission is indeterminate in keeping to our reports. And as you remember, more than a month ago, PAHO expressed its concern about the tests, about the tracking of contacts, reporting of cases, and these concerns are concerns we still have. Social distancing and the massive events are still being organized. PAHO is offering technical cooperation. Also, PPE has been given lab inputs, and we are waiting for the official information to be detailed enough for us to have an adequate analysis of the situation to have a joint response. Thank you, doctor. The next question, Bruna Lima from the Correo Brasiliense. The question is, what are PAHO's impressions in terms of the Brazilian response to the COVID-19 crisis? With a single health system, has Brazil managed to align strategies? What needs to be done to improve the response? Dr. Espinal, can you answer this question? Thank you for the question. As I said before, Brazil is a very large country with a very large territory, and each state is autonomous. There are three levels of government: federal, and municipal, and state. And we've seen that in the states are taking steps to face the outbreak in Brazil. At the same time, however, there is a risk, as our director mentioned, Dr. Etienne. An example is Rio de Janeiro. Dr. Alighieri mentioned Manaus. There are hot spots, areas that need special attention to strengthen social distancing, to increase the number of tests, and also education for the population. Brazil has a large population that lives in poverty, in the slums, and they do not have space for distancing. So measures should take this into account. One of the reasons why we see peaks in Latin America is that the virus is going to places where people have lower economic levels, where they're poor. It is important, therefore, for us to remember that social inequality in Latin America, not just in Brazil, are very broad. It's one of the most equal regions in the world. We have to be alert. Governors in Brazil are taking steps, and it's important that these measures continue to be implemented and strengthened in a very large countries where not everything is the same. PAHO will continue to work with Brazil, and we are ready to continue strengthening the mitigation measures that are being implemented to minimize the impact of this disease in Brazil. Thank you, doctor. The next question, Emol from Chile. The question is by Ramon Jara. How does PAHO see measures taken by Chile to not give a certificate of cure to those who have had the disease? Dr. Alighieri, can you answer this question? Thank you for the question. It's an immunological passport or certificate. That's not something we support for several reasons. The first is that we do not have uh, the it's not clear what the antibodies are and if they're present in those who had the disease. And in lab diagnostics, fast tests don't give us a perfect security. We don't know for sure whether the antibodies are there or not. At this level of the discussion, a discussion that is being held in all the countries at this point, those people who have gone through an observation period or have gone through a period of isolation can be identified, but you have to be very careful. Uh, the health authorities have to make sure that stigma is not a problem, as we mentioned before. Thank you. Thank you, doctor. The next question from Claudia Luna, Valencia, TV Azteca, España.
I asked several questions on the evidence we have in WHO or PAHO as to the impact of coronavirus in the minors and adolescents that has been of concern in Europe, mentioning that in Great Britain, there are children that have died because they get thrombosis, tachycardia, and some diseases similar to the Kawasaki syndrome. What do we know about this? Dr. Barbosa, maybe you could answer this question? Thank you for that question. Yes, the people that are under the greatest risk to develop the severe forms of COVID-19 are the elderly and persons with cancer, hypertension, diabetes, or other diseases that might involve their immune system. But a few days ago, there have been reports of syndromes in children, probably related to the inflammatory response and the coagulation and vascular processes. And that's being studied. It's a warning for pediatricians when they care for a child with COVID 19. But it is very important to recognize that all ages can be impacted. There is no age protection. If the elderly and those that have chronic diseases like hypertension or diabetes are a very special group because everywhere, including in Latin America, the data we have show that they are the most vulnerable to the severe forms. Thank you.
Gracias, doctor.
Thank you,
Siguiente
doctor.
pregunta
The
es
next
de Luis
question
Gabriel
is from Luis
Patiño
Gabriel
de
Patiño from
TV
BTI,
Venezuela.
from TV Venezuela, who says many speculate regarding the hiding of real COVID figures in Venezuela as a result of the health crisis, which has been most affected after the confirmation of at least 422 infected to date. How do you evaluate the public health system of Venezuela vis-a-vis COVID-19? What would be the main weakness, and will PAHO use any aid mechanism for Venezuela post COVID-19? And has the country reported the number of cases? Luis Patiño asks. Dr. Ugarte, you want to take that one? Thank you. That is also a very important question. The official figures in the case of Venezuela continue to be low. The fact is that less tests are being done to detect the presence of the virus in patients. And as Dr. Spinal said, there are many more tests to detect antibodies, the rapid tests. So there is really no possibility of adequately characterizing the epidemic as far as we know. In the health services, the health system, and the capacity of the Venezuelan health system has deteriorated in recent years. And that is a condition which, of course, limits our possibilities of having sufficient health staff, equipment, and supplies for COVID patients or beyond COVID. That's why it is so important to restore those health services so that not only can they save lives and adequately treat patients with COVID, but they can also improve care for all other health conditions and problems that require essential services. And in this respect, PAHO's cooperation is geared to strengthen those services as it strengthens the response capacity to COVID. The number of cases in Venezuela, as I said, is relatively low, and the health services have not been saturated, let us say, of patients. So we consider that the curve has not yet reached its peak, and the containment measures and social distancing and other measures that have been used are being successful. That cannot remain for a very long time because there are questions of economy and social reactivation issues that have to be considered. And that's why it's so important to maintain the surveillance of the cases as well as to strengthen the health services in the presence of a possible increase when these measures are relaxed. Thank you.
Gracias, doctor.
Thank you,
Tenemos varias
Doctor. We
preguntas
have
todavía que
several
nos están
questions that are
escribiendo
still
desde la
coming
chat.
in through the chat.
Esta es de
This one
Manuela
is from
Andreoni
Manuela
del New York
Andreoni
Times.
from the New York
Nos dice
Times.
una pregunta
Once
sobre
again, a question
Brasil.
on
En inglés
Brazil
pregunta,
and in English.
in the last few years, investments in Brazil health systems have fallen 12%, she says. How much do you see this affecting Brazil's ability to respond to the crisis? And how can local officials convince people to stay home and protect themselves? Are lockdowns needed in Brazil? Doctor Espinal puede tomar esta pregunta.
Well,
Bueno,
PAHO
bueno,
always calls for health investment, at least 6% of the public investment of the GDP. So that doesn't mean this is the final number. So countries' investment in health should be sustained, complete, and ongoing. It shouldn't be just one time. So the key issue, if not only Brazil but any other country that wants to achieve universal health, which is the flagship umbrella of PAHO under Dr. Etienne, will need to step up investment in health. Not only because many countries invest also on the private sector, but what we're talking about is at least 6% of the public investment out of the GDP. So if falling investment happens not only in a country like Brazil, but other countries, that will be a setback in countries. And the main message is that countries need to continue and investing in health, increasing it, sustaining it. And if we want to aim to universal health, we just talk about the most inequitable region in the world. We just talk about indigenous populations, groups, which in Brazil are very common, and also other groups of people living in situation of vulnerability. So the key issue here is investment in health should be a continuous issue. Let us not forget that development in a country should be, the pillars are education and health. So it's not only related to Brazil, but any country in the Americas and in the world. Thank you.
Gracias, doctor. Siguientes preguntas, tenemos varias de México.
Thank you, doctor. We have now several questions coming from Mexico. Isabela González from Reforma and Teresa Moreno from the Universal in Mexico. Isabela from the Reforma asks about tomorrow they're going to present the scale up reopening plan in Brazil, in Mexico, I'm sorry, and they're asking if the country is ready for this. And Teresa Moreno from the Universal also asks about the management of the pandemic and whether PAHO considers that Mexico was able to flatten the curve. Dr. Barbosa, can you take that question? Thank you. Thank you for that question. In a country like Mexico, as well as Brazil or Argentina or United States, there are differences amongst the states, provinces, and the region. The health authorities of a country, in a coordinated manner with the health authorities of each state, must carefully assess what is happening with the transmission. If we take the situation here in the United States, like the situation in New York where they had that explosion of cases, while in other states at the time there was a very low transmission. So the measures adopted in each country must be in keeping with the realities of the country. In Mexico, we have on average in the country an increase in the number of cases. And we recognize the need to identify what cities or provinces there's been this growth so as to decide whether the social distancing measures are working, and if not, what can be done to increase the protection of the population, like, for example, to increase social protection for the people, and if necessary, maybe implement new, stronger measures. All of these things must be done carefully, evaluating the reality of each part of the country, because in general, measures that may work in one situation in a province or city that have an increase in the number of cases might be different, because in that case you'd have to adopt measures to reduce the speed very quickly, while in other states or provinces it may not be necessary to have such stronger measures. So we have to adapt to each situation. But the trend in Latin America is such that we are appealing to all the countries to consider the need to make sure if something more can be done to reduce the speed, to have less severe cases, to save lives. Thank you.
Gracias, doctor.
Thank you, doctor.
Siguiente
And the next question comes from Ana Maria Rogra from BBC The World. Has PAHO identified a particular cause whereby the virus is more deathly in some countries of Latin America? Dr. Alighieri, could you take that question? That's a question that we'd have to take very cautiously. First, when we check a table of all the countries of the region, which shows the rate of deaths and confirmed cases, we must see the denominator. And that denominator will depend largely on the number of samples and patients' samples taken. Some countries are still having a challenge to expand the coverage and the laboratory services for the testing. That's one explanation. The second explanation, I'm going to relate it to one of my comments before when I spoke of the challenge of the large cities in the Amazon, where there was a concentration of poverty and the density and comorbidity. We're dealing with population groups and minorities where we have many risk factors, which could also be an explanation for the high number of deaths in certain areas of the population. But once again, we are in the, we're actually beginning a pandemic, and we need to gauge the services and the surveillance systems to be able to classify the mortality and the rate of mortality above all. Thank you. Thank you, Doctor. One Another question in the chat comes from Shamar Meusa from the Starbuck News, who asks,
What can be said about the possibility of the use of plasma of recovered patients for treatment of COVID-19 patients? What is PAHO's stance on the possibility use of that treatment? Quizás doctora Alighieri puede tomar esta también.
Dr. Alighieri, maybe you could answer that question as well?
Yes. The use of plasma of convalescent patients is one of the options therapeutics that's being investigated in different countries at this moment. You can access, we are posting on the PAHO website on a regular basis updates regarding the state of the art and the results of the investigation. At this moment, there is no recommendation for or against the use of this. This needs much more investigation at this moment, and different countries of the region are working on it at this moment. Thank you.
Gracias, doctor.
Thank you, Doctor. The next question comes from Ivan Weisman from Red Acción in Argentina, who asks, when the testing is relatively low, like in Argentina, what is the most relevant to assess whether the quarantine measures are effective? The rate of mortality, number of confirmed infected cases? Dr. Espinal, can you take that question? Thank you for that question, and it is very interesting. But the first answer is to try to increase the number of testings. That is what's actually going to give us clear indication of what the epidemic is doing. That's the first thing. Secondly, we could see what the mortality is like in other respiratory infections. And when we see, as we've seen in other countries, that there's been an increase of mortality due to other respiratory infections or pneumonias, that could be COVID. What's most important is that the country try to increase the tests, because that would even affect the rate of mortality and even the response of the country. It's important that we insist on increasing the number of diagnostic and detection tests based on the recommendation of international organizations of the PCR tests. As Dr. Ligeti said, the rapid tests, he corrects, Dr. Ugarte said, the rapid tests of antibodies are really not going to give us the breadth of the problem. They will serve to carry out long term studies on immunity and things like that. But the key pillar of the response is the testing. Of course, the rest, because it's a package, it's the PPE equipment, the risk communication, the preparation of the hospitals, all of that is very important. But to understand the size of the epidemic, it's important for the country to try to increase the number of tests, the diagnostic tests based on PCRs. Thank you.
Gracias, doctor. Y
Thank you,
ya
doctor.
vamos
And now
a
we're
la
going to
última
the
pregunta
last
que tenemos a
question.
la hora de
We're
esta
getting
sesión.
very close to the end of the
Esta
session, and
pregunta
the
de Matías
question comes
Loewy
from Matias
from
Loewy
Medscape
from
en
Medscape
español en
in
Argentina.
Spanish from
Pregunta,
Argentina, who asks,
¿consideran que
do
los
you
brotes en
believe that the
asentamientos
outbreaks
informales
in
que
informal
representan el
settlements,
21% de las
representing a
poblaciones
21%
urbanas de
of the
América
urban
Latina,
population in Latin
pueden
America,
ser el talón de
could
Aquiles
be the
de la
weakness
respuesta a
of
la
the
pandemia
containment
de las
plans of the
flexibilizaciones
pandemic
de la
and the
cuarentena
possible
administrativa?
relaxation or
Doctora
relaxing of the
Etienne.
quarantines? Dr. Etienne, could you
Thank
take
you.
that one?
And this is an important question. I think it is clear that this pandemic continues to highlight the persistent inequities within our societies that impact transmission, morbidity, and mortality. We have seen this in vulnerable populations. The urban, poor, migrant populations, and those living in conflict zones are at particular risk to COVID 19 as they lack access to the most basic services and, of course, the social determinants of health. Public health measures are more difficult to implement in these conditions. What we must do, therefore, going forward, in both the immediate response and as we build back in a post COVID 19 era, is transform our health policies, our social policies, and our economic policies to address the needs of these vulnerable populations. One of the lessons that we are seeing from this pandemic is that countries with resilient health systems that have worked towards the achievement of universal health and that have established strong social inclusive protection mechanisms are responding better to the current health and economic crisis. Our response, therefore, cannot only be in health, but in building health and social protection policies that that better protect people and, importantly, vulnerable populations. But we must keep an eye on those three things: social protection, universal health, and economic growth. Thank you.
Gracias,
Thank
doctor.
you, Dr. Etienne.
Ahora sí, entonces
And
hemos
now
llegado al
we've come
fin
to the
de la
end
sesión de
of
hoy.
this
Vamos a enviarles
day's
por correo
session.
electrónico las
We will
palabras
be
que aportó la
sending
directora, así como la
the
grabación de
director's
esta sesión.
opening words as well as
Pedimos
the
disculpas si no
questions of
llegamos
this
a
meeting. We
contestar todas
apologize
las
if we weren't
preguntas
able
hoy.
to answer all the questions
Seguiremos en
today,
la
but we
próxima
will
semana
continue
y pueden seguir
next
en
week.
contacto con
And you
nosotros
can
por
keep,
correo
keep in
electrónico,
contact
que
through
ahí les
email with
estaremos
us, and we will
contestando
be
lo antes
answering
posible.
there
Gracias a todos
as
por
soon as possible.
conectarse
Thank you
y
very
quedamos
much for being
conectados.
in
Hasta luego.
touch, and we'll be continuing with this. Thank you.